So to me, the cons of not being able, from a patient's point of view, of not being in an office where everything is done all in the same office, because to me it's the most important to look from our patient's point of view. Most of our patients have dental insurance, and so finances are always a concern, like with anything else in life. If a patient is coming to our office, it's almost 100% sure that we take their insurance. From a patient's perspective, if they needed a specialty procedure and we were going to send them to a specialist's office, one thing they have to be concerned about is, does that specialist's office take my insurance? How much is the how much is the procedure going to cost there? And so that's something that we wouldn't be able to tell them, and so it's not convenient, and it doesn't really make a lot of sense for them to have to go somewhere else where they don't know the doctor, they don't know the staff, they don't know the financial side of things, they don't know any of that. It takes all those unknowns out of there. Patients are comfortable in our office, so that's a pro for doing everything in our office. A definite con when they get sent to another office is, what if they feel uncomfortable with that provider working on them? I don't send my patients to specialist offices, so I don't know how this scenario would be, but I can imagine if I was a patient and my dentist sent me to a specialist office to get some procedure done, and I felt kind of like I didn't like that person, or I didn't have that level of trust that I had with my dentist, it would be hard to sit down in their chair and go ahead and let them work on me. I would rather go to somebody that I know and trust. From a convenience point of view, again, it's something that I've never experienced because we've always run our office as kind of a one-stop shopping. I don't know if that applies to dentistry or not. But I can only imagine being in the middle of a procedure, like we're doing a filling or a crown, and all of a sudden we find that decay goes very deeply into the tooth, and so we need to do a root canal. In our office, it's really easy. We just talk to our patient, tell them what's happened, go through details of the financial changes and any changes in treatment that we're going to do, but then we just go ahead and do it while they're numb. The reason that I decided to run our office as being capable of doing all procedures is because it just doesn't make sense from any angle that you look at it to go to several offices to have dental work done. To me, a dentist should be capable of treating anything that has to do with teeth and gums.